Our next keynote speakers are Dr. Mariam Aljunied and Dr. Vivien.
Dr. Mariam Aljunied is a chartered educational psychologist and associate fellow of the British Psychological Society. She is currently the principal educational psychologist with the Ministry of Education, MOE. In recognition of contributions to the advancement in the education of students with special needs, Dr. Aljunied received the Public Administration Medal from the President of the Republic of Singapore in 2009. As the winner of the 2011-2012 Fulbright Researcher Award postdoctoral, Dr. Aljunied undertook a research attachment at the University of North Carolina focusing on autism. She also contributes actively to several local and international publications and conferences on the subject of learning and developmental disabilities, and has been a long-standing partner with social service organizations serving the needs of vulnerable children and individuals with disabilities.
Dr. Vivien is a registered educational psychologist with more than 10 years of experience working with students with a wide range of learning and behavioral concerns. As lead educational psychologist with the Ministry of Education, Vivien spearheads efforts to enhance the quality of psychological services to schools and plays an active role in building schools' capacity to support students with special educational needs. Her current interests include building school support systems for students with learning and behavioral needs, social-emotional well-being of students with special educational needs, as well as interventions for children and adolescents with autism spectrum disorder.
Their topic today is titled More Than Meets the Eye, Understanding the Holistic Needs of Children with Dyslexia and Bridging Research with Practice. Aligned with research conducted locally and overseas, this presentation provides the convergent evidences for the current conceptualization of dyslexia and illustrates how this has influenced the implementation of dyslexia identification and literacy support in local mainstream schools. It also sheds light on the fundamental need often associated with dyslexia, that is, social-emotional needs. We would now like to invite Dr. Aljunied and Dr. Yang to come up on stage for this presentation.
Dr. Aljunied and Dr. Yang, please.
Okay, good morning, everyone. First and foremost, congratulations to DAS for consecutively organizing this very important and meaningful conference. Thank you for inviting myself and Vivien for this presentation. I want to first acknowledge the Ministry of Education, where both Vivien and I are currently working, as well as the University College London, where both of us were trained, and also I still have a concurrent role as an honorary senior lecturer at UCL. Some of the materials in this presentation were kindly shared by our colleagues from UCL, whom we continue to work collaboratively in terms of research matters. Today, if you Google, as what Gita has said, we Google now, we don't use the encyclopedia, thank God. If you Google dyslexia, you might get these images that highlight successful and exceptionally talented individuals who are known to be dyslexic. These are images or icons of dyslexia that the media propagates. The intention is clearly good, because it serves to remind us that having dyslexia in itself is not a barrier to being successful. It also serves as a positive role model for other individuals with dyslexia. However, the images of this media dyslexic unfortunately can have unintended consequences. Inadvertently, it reinforces the perception that dyslexia can only happen to people who are exceptionally talented, or exceptionally smart or intelligent. Yes, Tom Cruise, Richard Branson, and Jamie Oliver are exceptional in many ways. Yes, they have dyslexia, but compared to the rest of us, their talents in their respective fields are also exceptional. They are perhaps what Gita has said is twice exceptional. So while it's positive, there are unintended consequences. Dyslexia is one of the most researched and understood learning disorders, and there is general consensus on the core features and difficulties. However, there continues to be a disconnect between research and practice. While much has been understood about dyslexia, many perceptions still prevail today. So what we hope to do in this very short time is to share with you some of these persistent misperceptions. We will be sharing what are the evidence that has been clearly demonstrated about dyslexia. At the same time, we'll be talking about other aspects of dyslexia that are often not discussed at length, things that go beyond reading. More importantly, we want to talk about how we can help children with dyslexia build the resilience that they need to overcome the difficulties. There is indeed a worldwide convergence of evidence that tells us that dyslexia is primarily a difficulty in processing language and literacies. With intervention, many dyslexics can learn to read, but what seems to be persistently difficult for them is to achieve the fluency at which they access the print word. There is also robust evidence that dyslexia can occur in individuals across all levels of ability. This is certainly not a condition that can be found only in exceptionally talented individuals. In fact, this is one of the most persistent myths about dyslexia, that only exceptionally intelligent people can have dyslexia. Okay? While the media can be partly blamed for this, the truth is that this myth actually came from the practices of psychologists in the past. For a long while, when psychologists diagnosed dyslexia, they used what is known as the discrepancy approach. This was prevalent in practice until 1999 in the UK and 2002 in the US. Essentially, in this approach, a child is diagnosed to have dyslexia if the psychologist found a significant discrepancy, a big gap between his IQ and his reading. So the evidence of dyslexia is in the gap, and it must be a significantly big gap before, we have dyslexia. The approach is problematic in many ways. It wrongly assumes that IQ is the main determinant for reading skills. It also leads to the bad practices in the field. What typically happens because of this is that teachers wait. They wait for the child to show enough big of a gap before help is given. So if your IQ is here and your reading is here, sorry, is not big enough gap. You're not struggling enough. Let's give you time. And then you struggle some more. Yes, that's it. The gap is big enough. This is what we call the wait to fail approach. And I think for us it's completely illogical, but it's amazing how this approach seems to be a very persistent practice even today. Even though the evidence against it has been consistent and robust. So there's consistent evidence across many meta-analysis, brain research, from 1992 right up to 2013 that consistently shows the flaw in this approach. But still some people believe this, that it is a disease that somehow or other attack humans with above average intelligence. That's the absurd implication of the IQ achievement discrepancy. To the extent that in the United States, that they had to make a clear statement which eliminates this approach. So, if over there, psychologists cannot use it in their diagnosis of learning disability. So the question remains, if we can't use this approach, what are the alternatives? Thankfully, there is an evidence-based, valid approach towards the identification of dyslexia, and that is the response to intervention approach. To put it in a nutshell, this approach first assumes that everyone can learn how to read and advocates for a quality, evidence-based reading instruction for everyone as a first step. It proposes the use of progress monitoring and using data to inform instructional practice. The key thing is to watch how the child responds to the intervention and not go witch hunting for that sign of a disease. And depending on how well the child responds to reading instruction, the intensity of intervention is increased. So in this approach, the diagnosis dyslexia would be given to children who show persistent difficulties in acquiring fluency in reading in spite of adequate, good quality instruction. The RTI approach has been widely implemented in Australia, US, and UK, and it is also implemented in Singapore schools. Many of you would be familiar here. I see a lot of AEDs and teachers in school. So I think it's something that we have over the years, implemented incrementally, and thankfully it's in all our schools. The details of all the slides are in the handout given, yeah? So I'm not going to go through the details. So evidence also points out that many factors contribute to the difficulties that we see in children with dyslexia. But a common core deficit seems to be that level of fuzziness in making the link between the sound and letters, and the fluency and the automaticity in which that link is activated each time we read as fluent readers. Therefore, a standard treatment protocol, common to all, is obviously the phonics-based instructions and reading. But then again, that is important, but insufficient. This is another common myth in dyslexia, is that it is a vision problem. It is still prevalent. And I think, without going into the details, I have the references listed clearly for you if you wish to pursue this further. But in 2009, the American Academy of Pediatrics, Council of Children with Disabilities, American Academy of Ophthalmology, American Association for Pediatric Ophthalmology, and the American Association of Certified Ophthalmists clearly made a statement to refute this strongly. Yeah. Their assertion is that vision problems may interfere with the process of learning. However, vision problems are not the cause of dyslexia or learning disabilities. Right? This has been established consistently, and yet we still find this myth being perpetuated. And new evidence are emerging all of the time. So it is important that each time we get to know new information and evidences, we need to reflect and therefore refine our practices so that it is aligned with new and emerging evidences. For example, this study, published only in February this year, it points to a close interrelatedness between dyslexia and other developmental disorders. This is a randomized, double-blind study. You know how rare that is in education, and especially in dyslexia. So this study looks at children with dyslexia only and those that are diagnosed with dyslexia and ADHD. Both groups are treated with a medication that's commonly used to treat ADHD. The study found that, compared with controls, both groups showed significant improvement in reading after medication. So this overlap between dyslexia and other difficulties is not new. Over the years, much research has been done to study the comorbidity of dyslexia and other learning disorders. And I think Geeta made that point very clearly. Right? However, it's important to remember that co-occurring difficulties may be seen in all these aspects, but on the one hand, they may well be the outcome of the learning differences, especially the mental health issues. Right? But at the same time, the overlap between learning disorders could be possibly to a shared neurological risk. So I think while we see and reflect on the data on comorbidity, we need to be mindful that we are asking the right questions. Not that there's a right answer, but sometimes some questions will lead us more to the right action than some others. I'll tell you what, because the data on comorbidity is looking at the data with a very medical lens. In medicine, you're interested in how many diseases you have. You have one disease, do you have comorbid disease? Because the approach is one disease, one treatment. You have 2 or 3 diseases, I need to give you 2 or 3 treatment. That's a very medicalized approach, which doesn't necessarily align with what we know in education. Another way of looking at it is to ask a different question. We know that children with dyslexia are at risk of other difficulties. Some may be the cause, some may be the outcome. A more useful question that leads to positive action would be questions such as this: what are the risks and protective factors for children with dyslexia? We think if we pursue this line of questioning, it will lead us to better answers than looking at the comorbidity lens. One of the things that we take away from data on co-occurring difficulties is that it is not enough to just address the reading deficit. Right? And if we take on the perspective of protective factors, we then need to ask ourselves, what can we do to develop resilience? It's not about what other treatments do they need, but we know that the future, we can never predict the future. We can never predict for every individual with dyslexia what would be their difficulties. But evidence tells us there are clear risks and there are clear protective factors. We need to know that in order to build resilience. And at this point, I want you to hand the mic over to Vivien, who will delve on this even deeper. Vivien, please.
Thank you, Mariam. Hi, very good morning to everyone. I'm Vivien, and in this segment, I've got about 15 minutes to take you through this area of resilience in children with dyslexia. This is the overview of my presentation today. Now, how many of you have got the handouts with you? Can I just have a show of hands? No, okay. I've got handouts for this presentation, and I've included additional slides as well, just for your reference. So just to let you know that I will not be going through every slide in the interest of time. Now, some of you may recall this article that was published in the Straits Times sometime late last year, and it talks about this Miss Bianca Tan, who had dyslexia, and she struggled with dyslexia when she was schooling, and today she is an early childhood education teacher. So she was lauded as a success story, but if you look at the article and look at how her experiences were described, I think it highlights what many of us probably know about children with dyslexia, and that is the impact of dyslexia often extends well beyond reading and spelling, and that's something we've heard from the previous two speakers as well. So we go beyond these personal stories and we look at the literature, we also see evidence that having reading difficulties are actually associated with higher risk of both internalizing as well as externalizing problems. But at the same time, we also note that the literature is not entirely consistent because we do see some studies that show that children with dyslexia do not necessarily have poorer well-being than their peers. And we also see longitudinal studies or stories like Ms. Bianca Tan's that tell us that it is entirely possible for our children with dyslexia to grow up into well-adjusted adults. So what this tells us, what this underscores, I think, is two things. One, what Geetha mentioned earlier, that really the population with dyslexia is a highly heterogeneous one. And just because all these individuals share a common label, it doesn't mean that they all have the same kind of needs. So we do see different profiles and different types of needs among these students, both in terms of their literacy as well as in terms of their psychosocial well-being. So what exactly is resilience? Now, this is one definition. There are many definitions out there that you will see, but the common notion underlying all of them is that of adaptation, of beating the odds, of overcoming adversity. And I think what this definition also highlights is the process, that is a dynamic process. So resilience is not a stable, innate quality is within the child, but it is really a dynamic process that can change over time with changing life circumstances. So this is Bronfenbrenner's ecological model, and it sees the child as at the center of this network of interacting influences within the environment, whereby protective factors in a certain area could buffer against risk factors in other areas. So what this means is that dyslexia is not does not necessarily lead to poor social emotional outcomes. It is a risk factor. However, the social emotional outcomes for a child with dyslexia would depend on this interplay of resilience as well as risk factors in the child's life. So that brings us to a local study that we did on our students with dyslexia in schools. And these were the two questions that we asked. Two of the questions that we asked. The first one was in terms of their social, emotional, and behavioral outcomes. So we were interested, given some contradictory findings in the literature, we were interested to look at whether or not in our sample, did they have poorer social-emotional outcomes compared to their peers? So there were various outcomes that we examined, as shown on the slide. And the second question is really about the risk and protective factors that are associated with these outcomes. And again, we examined a few. So I'm going to go through these. Now, this slide gives you a snapshot of some of the key information. So we were looking at the primary 3 students, so the 8 to 9-year-olds. And it was a mixed methods design, which means we did both quantitative surveys as well as qualitative interviews with a small sample. And again, for your reference, in the handouts were some of the tools that we used. So given that we relied quite heavily on Charles' report, it's also important to know, I mean, a natural question you might have is, how reliable is this? Can we trust when a 7-year-old child reports certain social-emotional issues that they're experiencing? Now, if you look at the research, it does indicate that children as young as the age of 5 can actually accurately, reliably, with validity and reliability, report their own mental health status. And it really depends. So the onus is actually on us to identify developmentally appropriate measures. So of course, with our sample with dyslexia, we also did certain adaptations, and we also read the questions to them to ensure that reading would not be a barrier. So I'm going to go right into the findings now for question 1. So first of all, for self-report. Now in our sample, we did find that these children self-reported higher levels of social-emotional issues. So this included higher levels of panic and depression. Now I have to emphasize that we're not talking about clinical depression here, which is of course diagnosed through a formal process. So these are questionnaires that were administered to the students, and we're looking at their scores on the depression scale. It does not mean that these children were clinically depressed, even though we did follow up with a number of them, but this was a screening tool. So we're talking about panic and depression scores that were reported by these children. Children with dyslexia, compared to their matched peers, also reported lower levels of self-concepts across several areas, both academic, so you can see reading, learning, and schoolwork, as well as some non-academic areas, including peer relations. Now, a more positive finding was that despite having lower levels of self-concepts in these areas, it appears that their global self-esteem was intact, at least for this sample. So they actually had comparable global self-esteem compared to their peers, and this is their general sense of self-worth overall. What is less clear, because this was a cross-sectional study, we did not follow them longitudinally over time, what is less clear is whether they sustain this intact global self-esteem. So that was the self-report by the children. Now, what did their parents and teachers say? Quite a similar picture emerged. There was a high level of agreement actually across both teachers and parents. Those of you who are familiar with the Strengths and Difficulties questionnaire would recognize some of these as the subscales on the SDQ. So both parents and teachers reported high levels of social emotional difficulties across most subscales of the SDQ. The only difference between parents and teachers was the scale on pro-social behavior, and that was about how helpful the child is, how considerate the child was. And in this case, for pro-social behaviors, parents reported no significant differences, so they were comparable to their peers, but teachers did rate children with dyslexia significantly lower on pro-social behaviors compared to parents of matched peers without dyslexia. Moving on to question number 2, what are the risk and protective factors associated with these outcomes? So we did a series of regression analysis as well as path analysis for this. And one of the key things that came up was academic success. So the academic performance, as seen by their grades within the school, was a significant predictor of some of the social emotional outcomes. So the children that performed better academically tended to have lower levels of panic, which was a form of anxiety, as well as lower levels of teacher-reported difficulties. So what this tells us is that all the efforts that we're putting in terms of literacy and academic support for these children might actually have knock-on effects. So the two are interrelated, they are not separate. So the academic attainments would have knock-on effects on their social-emotional well-being. But that is not the full story, because analysis also showed that these two variables of social support and school belonging were significant predictors of their self-esteem. So children who reported higher levels of social support and higher levels of belonging to the school tended to have higher self-esteem. And that in turn predicted lower levels of depression scores on those questionnaires. And if you think about social support and school belonging, both of them relate to the child's connectedness with others in the school as well as at home. And this quantitative finding was actually supported by the qualitative interviews that we did, which I'm going to move into next. So we did a series of interviews with a small sample. We selected only 8 students, and we selected them from the different ends of the spectrum. Okay, so we selected 4 with the best possible social emotional outcomes, and these were based on the outcome measures that I talked about. So self-report, parent report, teacher report, and we selected the 4 that were doing really well, and the 4 at the opposite end that they were self-reporting a lot of difficulties, and their parents and teachers basically agreed. So we took these 8 students, so keep that in mind. We selected these 8 from opposite ends of the spectrum, opposite extremes, to kind of elicit the possible themes and the differentiators between the experiences of these two groups. So you may find that there's a lot of there are quite sharp contrasts in terms of their accounts, and that's the reason why, because we selected them that way. So the first common theme that we drew out from the interview transcripts was their perceptions of parent-child relationships. So the children who exhibited very positive outcomes spoke extensively about the kind of family support that they were receiving. So we asked them general questions about how things were going on at home, what was going well, and so on. So they were able to tell us examples, as you can see there, about the kind of support that they got from their parents. Now, interestingly, when we got the top 4 students for the positive outcomes, one of them was actually a child in care, and she was actually in a foster home. And she was the one with very positive outcomes. So when we interviewed her, she actually shared a lot about her uncle and auntie and the kind of positive home environment that they were providing her with, which clearly had a factor in boosting her resilience. Now, on the other hand, we also had the 4 children who spoke not so positively about the home environment. So they spoke about things like physical discipline and a lack of academic support and a lack of a conducive environment at home. So this is just further research on the related area of the importance of the parent-child relationship as a protective factor for our children. The next theme that emerged from the interviews was the area of teacher-student relationship. So beyond the family, within the school, when we asked these children about how school was going, what was going well, what did they like about school, again, the students with positive outcomes were able to talk about their teachers in quite a positive light, and they were able to give examples about favorite teachers and the support they were getting. Whereas, on the other hand, we had the students with more negative outcomes who gave also various examples about unfair treatment by teachers and so on. So these were very much the students' perceptions, which of course are important because we're seeing this through their eyes, what they were experiencing. So those are some quotes that we drew up from the interviews. And again, further research can look at into the area of teacher-student relationship as a protective factor for our students. The third area was peer relationships. Now, this was really a huge contrast because when we asked them what they liked about school, the students that were of positive outcomes gave a lot of examples of their friends. There were no social difficulties that were mentioned. They were able to talk about activities that they did with their friends and so on. And they liked coming to school because of their friends and their teachers. On the other hand, we had frequent mention of social difficulties among the children with the negative outcomes. There were instances where they talked about being bullied, being socially excluded, and so on. So clearly, peer relationships was a factor that differentiated the experiences of these two groups that we interviewed. Now, if you look at the research, the impact of peer relationships is even greater when they go up to secondary school in their adolescent years. And it's been shown that a quality relationship with just one best friend, so you don't need hordes of friends, but just one best friend, actually has a huge impact on their social emotional outcomes. Another theme that emerged besides the relationships was actually the child's ability to compartmentalize dyslexia. So, for example, we asked these students the same question. We asked them, what are you good at? And all these children with negative outcomes had a lot of difficulty with this question. One of them actually replied nothing when asked this question. So we tried prompting and we tried giving examples, but these children appeared to view their difficulties as being very global. So then when we asked the flip side, what are the areas that you think you're not so good at? Then these children suddenly, they were able to give extensive list of areas of difficulties that they were struggling with across the board. So it's not just about reading and writing. They talked about maths, about making friends, and other areas, PE included. And of course, on the other end, we've got the children with positive outcomes, and all of them were able to list at least one, if not more, strengths when we asked them, what were you good at? Many of them, there were only 4, so 3 out of 4 of them were also able to give examples of how they had the opportunities to develop these strengths. So, for example, one of them, he said that he was good at football, and he said that he was the goalkeeper for the school's football team. We asked them another question, which was, do you think that your reading will improve when you're an adult, when you're all grown up? And again, there was a sharp contrast where the children with positive outcomes gave a unanimous, yes, I'll be better, I'm improving and I think my reading will be better. Whereas the children with negative outcomes were less sure. So 2 of them actually said, no, I don't think so. They couldn't really elaborate on why. One of them did say, because my teacher said I've been getting U grades, which is ungraded. And that was why the perception of their difficulties was a lot more persistent, global, and global as well. This was not really an aspect that differentiated between the 2 groups, but it was a common kind of observation across all the students that we interviewed, because we also asked them whether they've heard of the word dyslexia. We didn't quite go into that, but we just asked them, have you heard of that? And none of them had heard of it, and these were 8 to 9-year-olds, so maybe that's why they were still young. And then we asked them, do you think you have a reading difficulty? And most of them said yes. But when we asked them, have you thought of telling somebody about it, or have you told someone about this difficulty and maybe they can help you? They were very uncomfortable about telling others about this, and these were some of the things that they said, why they wouldn't tell other people about this difficulty that they had with reading. So there were a lot of concerns about the social impact of disclosure. And that brings us to this topic about self-awareness, a related aspect about self-awareness of their own difficulty and self-determination. For the parents among you, you might have thought about this question, should I tell my child? Maybe your children already know, especially those who attend the DAS, they might ask you, what is dyslexia, why am I here? And really in the literature now, there is very little research on this topic of disclosure of disabilities to children. And so I'm not able to share kind of evidence-based guidelines on what to do, but these are some considerations that you could think about. First of all, severity. How severe is your child's difficulty? Your child's age and maturity, as well as the social emotional impact. How is this affecting your child's functioning in daily life? And really, if you choose to share with your child about the difficulty, perhaps the term dyslexia, or just talking about reading difficulties, the ultimate goal is really for self-determination, and it is for your child to be able to understand their own strengths and weaknesses, to be able to take control of their own lives, and to request for assistance when needed. So these are some tips that are included in your handout, so you can have a look. So it talks about framing dyslexia as part of diversity, and of course, emphasizing and celebrating the unique strengths that your child has, and ensuring that your child knows that dyslexia is not something to be ashamed of, and that he or she is not alone. So these are some local stories that our children need to see, because they send a very positive message of hope and resilience, of beating the odds. And besides sharing positive role models with them, here are some other strategies that you can consider in terms of building resilience. First of all, we know how important relationships are. So in addition to the intervention for literacy, we need to also think about how we can strengthen the children's connectedness with others, their relationships with peers, with family members, and the wider community. We need to see the whole child, not just what they can't do, but what they can do, and to provide them with opportunities to develop these strengths. Because for many of them, these are going to be the things that will spur them on in life. We may need to teach them coping strategies, like positive thinking, positive self-talk. There is a lot of, there's a huge knowledge base on this area, on teaching coping strategies based on CBT, cognitive behavioral therapy. Mentoring has also been a promising practice with some research evidence for building supportive relationships. And lastly, the need to monitor the response to intervention, that's RTI, and the well-being of our at-risk students. And these are the ones who may have a lower balance of those protective factors that we just talked about. And if you're interested in this topic, this is a fairly recent article that provides a good summary of some of the key issues in resilience. So today I spoke about social emotional resilience, but this article also talks about the area of cognitive resilience. So you might be interested to look at that. That's in your handout as well. So I'll end with this quote from Nelson Mandela, because the truth is, our children with dyslexia are probably going to experience some form of failure or perceived failure at some time or other. So as adults working with them, it's important for us to think about how we can boost these protective factors and their resilience to ensure that they can rise every time they fall. Thank you.
Thank you, presenters, for your insightful research, providing useful information for practitioners in the field. May I invite Dr. Aljunied to come up on stage once more to receive the token of appreciation, together with Dr. Yang.
Dr. Aljunied, please. I invite Mr. Eric Lee up on stage to present our presenters with a token of appreciation.
May we give them another round of applause?
Thank you, presenters, and thank you, Mr. Eric Lee.